Good afternoon, sir. I am Ret-dem A.Y from BSN 2A Group 2, and today I'm going to demonstrate the bag technique for the home visit. And for the assessment, first we need to gather all the equipments that we need, like PHN bag and its contents, and other paraphernalia for the home visits, like the CHN logbook. Second is we need to identify our client and gather all the informations or data or necessary data. We can get that by looking for the RHU family folder, or we can ask the other members of the healthcare teams who handled the clients. Third is upon locating to your client, you need to greet them nicely and introduce yourself. So let's say, for instance, I am on my duty for the CHN and I'm going to knock on your door, and you are one of the family member who opened the door for me. So, good afternoon, sir. I am Ret-dem A.Y. I am a nursing student from TSU or Tarlac State University, and you need to state your purpose for the visit and explain to them what you are going to do, because by doing that you can get their trust and they can get you inside their house or their properties. And then by that, you need to observe your client and determine their health needs. And always remember that you need to provide privacy. So now let's go with the planning. So first, you need to formulate your nursing objectives for the home visit. Second, in planning for home visit, you need to consider and give priority to the for the essentials, and recognize the needs of the individuals and his families. Second is planning in doing the delivery care should involve the individual and family. And lastly, planning should be flexible. So for the implementation, upon arriving to the client's home, you need to look for a table or a flat surface and get your plastic lining, prepare plastic lining, and put the bag on the table or any flat surface. You need to put the plastic lining clean side out, means the folded part should be touching the table, and put your CHN bag at the upper corner of the plastic lining, and the handles or the straps, place it beneath the bag. And always remember that the CHN bag should be 6 feet away from your client. And now, you can actually ask for a basin of water or a dipper of water and place it to the outside your working area. And then you can open your CHN bag and get the soap and hand towel and also the apron. Put it on the one corner of your plastic lining or your working area. And then you can put the plastic wrappers inside your bag and close your bag. So now you close your bag. You can wash now your hands and wipe it and dry it using the hand towel. apron, right side out, wrong side in, to the head, from the head sliding to the neck strap, and neatly tie the strap at the back. Then you can open your station bag and put out the things needed for the specific cases you visited on. Like if there's a pregnant woman, postpartum, mother and newborn, school-age child, or a morbid case, and they are your family caseload. So we have here the 70% alcohol BB app, which is, no, it's not BB app actually. You can call it BB app. This kid that is opening, and this is the kidney basin, kidney shaped basin. You can get the thermometer and the wet alcohol or cotton balls with alcohol, and then put it on the one side of, or the corner, one corner of your working area, which is with the plastic lining, and then close your bag. If you're closing your bag, you can put the waste paper bag outside your working area. And now you can now proceed to the nursing care or treatment. It is very dependent on the health situation or the family or client you will be visiting. After doing that, or after doing the nursing care or treatment, you can clean, wash, dry, and sanitize all the things that you use with 70% alcohol. But as this one is a wet cotton balls with alcohol, you can use this to clean the things used. After that, you can wash again your hands. And now open the bag and turn all the articles inside the bag with their proper places. And then put away the apron to your body, and then you can put it away to your body and fold it inwards with soil folded inwards, inside out, and then put it on the switch and bag. And then close the back. And then get it. Now you can fold the plastic lining and put it on the plastic. And then close the back. So, I'm sorry for the change of location po because it's raining outside, so you can hear some raindrops po. So, I decided to get inside the room. So, now let's proceed again to the demonstration or demo. So, next thing to do is to make a post-visit conference on matter relevant to the healthcare by taking anecdotal note for the preparatory in the final reportings on the CHN logbook, and also you can take note for the environmental factors that can affect the client or the family. So next is to make appointment for the next visit, either it's in the clinic or at home, and also take note for the date, time, and the purposes. So last thing to do is to do aftercare, wherein you keep the place or the area clean, and return all the articles at the bag or the right or proper places in the bag. So after that, now let's go to the evaluation. So first is to record all the findings, observation, and health problems that you identified about the client and the other members of the family that you visit. Second is to include quality nurse and patient or client relationship. Third is to document all the findings, document all the nursing care and rendered, and evaluate the effectiveness of the nursing care provided. So last is to refer to the RHU if there is a aberration from the normal findings. So that's it.